Hello everyone, this is Dr. Lori Langdon, board certified pediatrician, mother of 6 and grandmother to 2, here today with a very timely topic, I hope, and something I don't think we've ever needed to talk about until now in the pandemic and this extremely contagious variant called Omicron. So you probably know that in a lot of pediatric offices, we are now trying to see patients who are sick or have a fever, potentially infectious, obviously with a fever, outdoors, so that when you do come in for your newborn well check, or your regular checkup visit for your babies and kids, you don't have to be nervous about being in danger by coming to the pediatric office, right? So we do this on purpose because, as you know, in our whole country, we've had a decrease in routine childhood vaccines because of this fear. So we want to make sure when you are well at a visit that you feel comfortable and safe in our office. Now, sometimes we might have to do some hybrid models and maybe in a separate entrance and door closed, extra clean the room, things like that. But for a lot of people, especially lately with the unbelievable surge of number of cases of Omicron, we are, at least my office, currently seeing a lot of those patients outdoors. So that has made for some brand new ways to be incredibly awkward with one another, the patient and the pediatrician. So I thought maybe it could help both of us if I came up with a quick list of tips or sort of a how-to for drive-through etiquette, okay? So the first thing is a practical one. The way my particular office works is, this is pretty cool too. Who knew this when they built the building over 20 years ago, that we would ever need a 2-lane drive-through attached to the side of a building? Very substantial, somewhat like an overgrown 2-lane carport, but boy, has it been handy for this current pandemic. So we need you to call us when you arrive, because the physician and the nurse is most likely indoors putting things into the computer or seeing those well visits we were just talking about. So we may not know. We don't have a window where I am out to where you would be driving through. So if you could just give our front office a call when you arrive, that will be noted. And even sometimes my nurse may call you and get a lot of details about what's been going on and why you're here, so she can go ahead and input that into the patient's chart for that day's encounter, and then we'll come out to see you. So most of what our drive-through lately has been are just for COVID testing, of course, and we'll talk about those different kind of tests. So number 1 is call when you arrive. Number 2 is related. Make sure that we have a working phone number for you. So let me explain the test briefly. There are over-the-counter tests, rapid antigen tests. Those are fine. Do you have to come see me to be diagnosed with COVID? Absolutely not. If you tell me that your rapid test at home was positive, and we pediatricians across the country cannot handle the volume of phone calls and patient visits right now, I'm just going to say, believe the rapid test. If you did it properly, and you wouldn't have done it, I presume, unless your child had symptoms or you had some reason like an exposure to check the test. If you checked it and it's positive, then your child has COVID, okay? It's not the end of the world. Your child does have COVID. Of course, you are welcome to call the office for advice and counsel. Of course, we are happy to see your child if you have additional concerns. If they're wheezing, if they have an earache, if there's a persistent fever, if you're concerned for dehydration or decreased urine output, absolutely, we want to see your child. It's not that we don't want to see them, but we don't need to see them if it is just to verify a test you've already done. You must understand there's a nationwide shortage of tests, not just over the counter, but for us too. So my favorite test in this whole crazy pandemic has been this really cool fancy one made by a company called Cepheid, C-E-P-H-E-I-D. And I used to have them, and they were awesome. And they were an in-house test. So most of us, when we say rapid, we mean not just that it's quick, but that it's a rapid antigen test. Same sort of technology as a pregnancy test you would do at home, right? Well, for a while there, until we ran out, Cepheid company made something called a 4-plex, which in about 40 minutes on one of their fancy machines was an actual PCR test, the gold standard for COVID-19 plus flu A, flu B, and RSV, all of which we are currently seeing. Man, I love those things. So I would find out in the same day, and you would find out in the same day, if it was any 4 of those viruses causing the child's fever. That was so super nice. So we have been in and out, but I currently happen to have rapid antigen test again. We haven't always. We do this week. Now we're back to, if we need a PCR, we're back to the send out like we were doing at the beginning of this whole thing, which varies on how quickly they can get back. Because the surge is nationwide, even our reference labs are inundated with tests, and so it may take even more than 48 hours to get those back, which is a bummer. So I apologize, you guys. It's not that we don't want the fancy kind in which we get results back the same day. We do. It's better for us. We can get all of our phone calls made and not have to check labs over the weekend or Sundays and holidays and try to call you guys back. It was so nice. We don't want to be out. We just are. It's the reality of where we are. And I mean, we should expect it after all this time. I guess things aren't always going to be simple or straightforward. So rapid antigen tests that are quick can often just reflect the amount of viral load. So they're pretty useful. If they're positive, I believe them. Now, if they're negative, they are very prone to being very time sensitive. So let's say you tested too soon, they're going to be negative. So it's more likely to have a false negative with the rapid antigen test than a false positive. False positives are pretty rare. So if it's positive, I believe that you do not have to come to me just to confirm, please, because we're busy seeing the kids who are having wheezing or dehydration or other more complications like ear infections and things like that. You can even get croup from COVID, we now know. So we need to save the visits if we can for those kids who need to see us for a specific issue, not just for testing alone. And that rule goes a million times stronger for the emergency department. You would never, ever, ever, ever go to the emergency department just for testing alone. That would be terrible. Okay, so far we're up to call us when you arrive. Make sure we have a phone number because we're going to be doing a test that we're going to need to call you back with those results on. Okay, number 3, make sure there's an adult in the car that knows the history of this child. Something about the nature of it being a drive-through. Some families seem to think that you just find someone who's a driver and they're qualified to transport the child to the drive-through. And yes, they are. And I do appreciate their services for any random uncle or brother or grandpa or someone who's gotten roped into driving this sick baby to the doctor's office. I do appreciate your services. I promise. It's just that I really need to know what's going on with the baby, particularly now in this pandemic. I need to know if there was an exposure, who was it, how close was it, and how many days ago was it. I need to know for infants, how many wet diapers have they had in the last 24 hours? Has there been a fever? How high has the fever been? I need someone who can provide an accurate history driving this baby to the doctor. So please make sure someone in the car knows what's going on with the baby. That would be absolutely helpful, and I appreciate it very much. Also, this sounds obvious, but I mean this kindly but sincerely. Don't smoke in the car. You guys, you just don't even know how crazy this has been for us. When I'm coming out to see your child in this car in the drive-through clinic, I will have on a gown, I will have on gloves, I will have on an N95 mask, which can be most uncomfortable that we have to leave on all day. I will have on goggles. It's a lot of stuff. Okay, so we're already a little uncomfortable. Now, if I have to examine your baby inside of your car, which is typically what we're doing, and you've been smoking in your car, that is very horrible to me. I don't want to smell like smoke for the next newborn I see. But it is most horrible for your child. So your child doesn't have a choice. It's one thing if you smoke and choose to increase your cancer risk for your lips and your gums and your tongue and your esophagus and your trachea and your lungs and your entire body. That's your choice. But it's not the child's choice. And we know that it increases the rate, doubles the rate of sudden infant death syndrome. It does all kind of horrible things to children. Increases their chances of having asthma. Increases their chances of being hospitalized with pneumonia. Increases their chances of getting pneumonia. Prolongs the number of days of illness with a cold. It does horrible things to children. So please don't smoke around your child. And I don't mean just tobacco. The other day there was a car. We opened the door and we could just smell the marijuana smoke coming out of the car, and that baby was in the car with the parents. Guys, you don't need to smoke anything around your baby, and it's particularly rude if you're asking me to join you in the car and it reeks of tobacco smoke. Let's not do that. Okay, along those lines of being kind to your healthcare workers, because we are, after all, actual human beings, I would kindly request that you turn your engine off when I'm trying to hear your baby's heart and lungs. So I had a case several weeks ago for a little girl who had a high fever, severe cough. Well, that's what everybody is right now with flu, which we're seeing, and COVID, which we're seeing so much of. But the mom actually, I didn't even request it this time. The mom just said, oh, let me turn this off so you can hear better on your exam. That's right. You guys, we share the same motivation, and that's for these children to get the highest quality medical care possible. And that includes a high quality physical exam, right? And so she turned off her car's engine, and radio and all that stuff that could interfere with the quality of my exam and my ability to hear those lung findings. And sure enough, this child had, when I was listening to her back at the bottom on the left, some very fine, faint, those were crackles. And so I asked my nurse to roll out the pulse oximetry machine from inside, and we checked her oxygen level, and it was abnormally low. And we ended up sending her to the hospital, and she ended up getting admitted for days and days and days with pneumonia. What if that mom hadn't voluntarily and kindly offered to turn off her car? What if I hadn't heard those crackles and started antibiotics, and then she couldn't tolerate, and ultimately we sent her to the hospital? It could have had a bad enough outcome as it was. It could have been even worse. So guys, if we're both on the same page and we want a high quality physical exam for your child, I need the background to be as quiet as possible. It's already tricky when we're outdoors. We're not that far from a road, and sometimes some big 18-wheelers will go by, and I just have to stop and say, give me a minute till that noise is over, then I'll restart examining your child. So turn your engine off and try to decrease all those background noises so we can have a higher quality physical exam. So don't smoke, turn off your engine. Here's another big one. And parents just don't know this, and we're learning this as we go too, but a lot of times the baby will be, in, as it should be, in the back seat, strapped into the car seat, rear facing. Absolutely, that's the right thing to do. In fact, if you didn't have your baby in a car seat, that's a bigger issue. Something else we've seen a few times in the drive-through clinic, because we realized, wait, there are more children, count, than there are car seats. That's a problem. So yes, please have the car seat. Have the baby safely strapped in the car seat appropriately. And often, depending on how the schedule's going, the nurse may come out before I do so she can check a temperature or do whatever she needs to do, and maybe even go ahead and do the swab. For her with a small infant, it may be easier for the baby to stay in the car seat. That's totally up to you and the nurse. But I need to do the full exam. I need to listen to the baby's heart and lungs and its mouth, check its ears. And babies usually don't like me to check their ears, so I'm probably going to need some help with you giving a big hug and stabilizing the head for me, but also just to check their lung exam on the back. If they're strapped into the car seat, I can't get back there to hear good breath sounds. So it's going to be a lot easier for me if you could take the baby out of the car seat and then hold it so I can get a high quality exam, especially their ears, because any of these upper respiratory infections we've mentioned so far could lead to an ear infection or otitis media. So it's really important that I get a quality exam of their ears so we make sure that we don't miss an ear infection. Also, this one has come up a lot lately, and it kind of hurts my feelings. Kind of in keeping with that theme of medical care providers are also human beings. The nurse that comes out to your car, the pediatrician. I currently have a medical student. There may be several people that interact with you guys. And often we'll have the door open as I'm beginning to examine the child. If they're older, maybe they're in the front passenger seat. If they're younger, maybe in the back seat. And the parent, the mom or the dad, is providing the history for me. And as we're going through the history, which day did the fever start? Are they coughing a lot? Are they drinking enough fluids? Oh, and who was we're checking for COVID today. How close was the exposure? Was it on the school bus? Was it at their in the lunchroom, at their lunch table? Was it a classmate beside them in class? Who was it exactly that was the contact? And the mom or dad will say, oh, it was me. I'm positive. I just tested positive 2 days ago. Guys, put your stupid mask on. I am practically on top of your child inside of your car where you've been breathing, and Omicron is very aerosolized. For the love of all that's holy, put your mask on. That is so rude. Can you not see that? You are highly infectious right now. You know you are positive. You know that's why you're at the doctor's office right now. How could you not be wearing a mask when I have to join with your family inside the car to do this exam? The other day that happened, and it was an older child, so I just, instead of practically sitting on his lap, he was much larger than I was, I just said, buddy, I didn't say it out loud, but I was thinking, since your parent is currently coughing on me and you, that's a problem. How about let's step out here and I'll just listen to your heart and lungs and check your mouth and ears in the open air. We'll get some better ventilation out here. So please be considerate of your healthcare providers. We are people. We are short-staffed because of this. So many people right now are out with COVID themselves. Please protect us so we can continue to help you by masking up when you know you are positive. It's just polite even if you didn't know you were positive, but when you were recently actively positive and obviously currently actively symptomatic, please protect us. So a really quick review on masks, you guys. Cloth masks are protective for other people from you. Cloth masks help hold your respiratory droplets in, and that's important. Now, they don't seem to have been as effective against Omicron, sadly. But even some of the studies in school children, even since Omicron, have still shown masks to be effective, just normal cloth masks. So this would just be a normal cloth mask. It just goes over your nose, your mouth, and hooks around your ears. And guys, it does matter that your nose and your mouth are covered. I'm so tired of seeing people in grocery stores or wherever with their nose out. There's no reason to have it on if your nose is out. Do you understand? You breathe with your nose. Respiratory droplets come in and out of your nose. It's not protecting you. It's not protecting anybody else. Your nose has to be included. Oh, I'm so tired of that. Then the next step is a surgical mask. It has like that bendy wire in the part that fits over your nose, also ear loops, and covers your nose and mouth, obviously. And then there, at least in my office, we have two different kind of N95. So this is one of them, and it's actually my favorite kind. Let me just open this here for you. It's really tight though, so you can imagine it by the end of the day. Not only is our mask acne really bad, mine's covered up with makeup right now, but we're just exhausted because it squeezes your head off. But it has, I'll just show you on the back side. So the side that I would be wearing, this is the inside, that squishy part goes over my nose. It looks like it'd be comfortable, and yet somehow it's not. And then that's bendable with the wire inside to form a better seal over my nose. And then this stretchy part goes over your chin. The point is to not let a lot of air escape or enter, obviously, because we're trying to protect ourselves from the virus getting in there. And then this other one I don't think is very attractive. That doesn't matter. I'm sure it's very effective, but it's not super comfortable either. It's just so tight. So the N95s that I work with at work are always going to have two different attachment stretchy bands, so they're horrible for your hairdo. So if you ever see me in this drive-thru we're discussing, I'm going to look rough, man, and that's just how it is, and it's times are tough, but we're all going to survive. We're all going to get through this. Let's just pray this Omicron peaks and goes away. And now one more quick one, and this applies for all doctor visits of all ages, indoors and outdoors, and particularly the drive-thru, because we have been so busy lately. The other day I walked out the back door and cars were literally lined up from my drive-thru area, the fancy carport area, all the way to the road. And I was kind of freaking out because there weren't even that many patients on the schedule, but they were all there to be seen. And that was kind of tough on the old blood pressure. But here's the final tip. Please get off your phone. Guys, I'm not out there trying to talk to you and take a history on my phone. This is special time. You have held this slot, this appointment time. Say it's 10 o'clock, and I'm actually trying just as hard as I can to stay on schedule. And I'm running out there, and I had to just change everything. And I got fresh gloves, and I got my stethoscope and otoscope and the otoscope tip and everything. And then the other day this happened. It was my nurse and my medical student and me, and we were just standing there trying to ask the mom just the basic history. Has there been fever? What was the day of exposure? Are they drinking fluids well? How long have they been coughing? And all the usual. Any ear pain, any sore throat? Do we need to check for strep too? That's important. We don't want to miss that. And they were just fully on the phone, laughing, carrying on. It wasn't a death in the family or an emergency. I'm not trying to be judgmental or mean, and I know there are always exceptions. But guys, this was just a silly phone call. And they were literally in our drive-thru with all these cars behind them. And we're desperate to stay on schedule and respect your time if you're in one of those cars behind them. So please respect all of us and your own child. Just get off the phone when it's time to give the history to the doctor at your child's visit. I hope these have been helpful. I'm going to do a really quick run through. So call us when you get there. We're trying to stay on schedule. Make sure we have the right phone number because we might be calling you with lab results. We need an adult who knows the history. Please don't smoke. Turn off your engine. Make sure you get the child out of the car seat so I can see them easier. Wear your mask and get off the phone. Thank you so much. I hope I didn't hurt anybody's feelings. I'm just trying to teach you some drive-thru etiquette. Thanks.